Hello students, welcome to the very important session, and in this we are going to discuss some of the important instruments in your obstetrics and gynecology. So this is going to be a very important session because for two benefits. One is for any entrance exam nowadays as a trend, and one instrument specifically is being asked. Okay, so many of these are Virgin MCQs, all likely to be coming in the future exams. So we're going to show you the instruments. And also mainly you should not only know the name, they will tell you to which surgery or which procedure is this being used. So you should know 2 to 3 operations or 2 to 3 practical cases where this instrument is being used apart from the name. Okay, and of course for final MBBS it is going to be a superb revision. Your entire almost practical tray will be done because almost all of you are going to be asked 1 to 2 instruments for sure on your Viva table. So it's a very important session for final MBBS students, and in the MCQ exams also instruments are will be shown to you as an image based MCQ. So all these are image based MCQs and with a special focus only on the instruments. Okay, so let us begin the discussion and let us go on to the first MCQ, the first image. Identify the instrument and tell me which surgery or where. Tell me the use. Okay, the option is in which part, where, what is the use of this instrument. That is the question. Do I use it in tubal ligation, to hold the uterus edges or angles in LSCS, DNC, MTP, all of the above? Anybody? So point number one, you need to remember that, can you see like this a triangle? Yes, this is like a triangle, and this is what, this is a so this acts like a hemostatic part. Okay, so this is the green Armitage forceps. Okay, majority of you have not been shown this instrument in your final year. Okay, and that's why very likely to be coming. Of course, this is a Virgin MCQ likely for the future exam. Okay, green Armitage forceps. And where is it used? Okay, so this is a green Armitage forceps, and the part of this, as you can see over here, this part which is here acts as a temporary to clamp, so that basically the blood loss. Okay, so it is not used in tubal ligation. Tubal ligation, which instrument I'll use, will show you again in this session only. Of course, there is no role in DNC and MTP. It is to hold the uterus edges or angles in LSCS. That means what happens is that when I cut open the uterus, okay, all of you pay attention. Okay, this is the uterus, and at the time of cesarean section, when I cut open the uterus, all this part is going to bleed, isn't it? Because I have cut it. So basically till the time I start suturing it. Okay, so this is the incision from where I have delivered the baby. Now all this part is going to bleed. So till the time I start suturing, we are going to apply this instrument. Okay, we are going to apply this instrument, okay, over here and over here. Is this understood to all of you? So this is how the green Armitage forceps. So remember the name and also tell you some historical importance. Okay, so green Armitage, very important. How to identify long instrument? There will be a clamp catch at the end, and it will be the only instrument which has like this triangle. Okay, if you can see this clearly, like this triangle part. Okay, if you see something like a triangular thing. Okay, so this is what it is. Okay, so when you have a base like this and a triangle part going like this, so this is this, we have shown you this part so that you understand. So this is the green Armitage, and what is the use, sir? It is to temporarily clamp it's temporarily hold. Okay, temporarily hold the uterine edges and angles, and then of course you start suturing, and once you suture it, once you take the stitch, you remove it, and then of course you suture the whole lower uterine segment. Okay, so this is a very important instrument, uterine edges or angles hold in LSCS. If this instrument is not available, then many times even Alice forceps can be used also. Okay, but preferably this is used. So this is one and only one indication. Okay, only one indication. It is for LSCS surgery. Sir, I have seen it, final year student, and they will tell you which surgery have you seen this being used. Sir, it is in LSCS operation. Okay, just some historical things. So it was Vivian Bartley, green Armitage. Okay, British gynecologist. okay, and he was also service in Indian Gynecology and Obstetrics, and also served the British Army in the First World War. Okay, so this was Vivian Bartley Green Armitage, and British gynecologist who has devised this instrument. This is just a trivia. Even if you don't know this, that's okay, but you will not get this anywhere else. Okay, so Green Armitage forceps used to hold the uterine edges and the angles. Okay, this is called the angle. This part is called the angle. Okay, this is called the angle, and this is of course the edges. So to hold the uterine edges and basically lower uterine segment, where you made a cut in LSCS surgery. Okay,